In this video, we will learn about the qualifications needed to become a neuropsychologist.
So can you tell us a little bit about your job and some of the day-to-day activities?
Neuropsychologists dive really deep. We work with pretty much one client per day, sometimes 2 or 3. We spend multiple hours gathering information, doing standardized tests to try to get a sense of what a person's strengths and weaknesses are when it comes to thinking abilities and functioning in everyday life, so that we can come up with recommendations to help them be more successful. Face-to-face time with the client is about 5 or 6 hours.
Wow.
Mm-hmm. With much younger children, the hours can add up because you can't push them so hard to keep working, because it is it's hard for the client. It's a lot of thinking, so sometimes it gets stretched over several days, just collecting data.
So what are some of the qualifications that people do need to be a neuropsychologist?
There are very specific guidelines for how to become a neuropsychologist, and those are called the Houston Conference guidelines. So if somebody knows from the beginning that they want to be a neuropsychologist, they need to get familiar with those guidelines as soon as possible. Before you become a neuropsychologist, first and foremost, you have to be a licensed psychologist. That's sort of the foundation of it. And in order to be a licensed psychologist, you have to have a doctorate in either clinical psychology, school psychology, or counseling psychology. So long as you get training in brain and behavior relationships and assessment, those would be the 2 main ones. The only difference between a licensed psychologist that's sort of a general psychologist and somebody that calls themselves a neuropsychologist is the 2-year postdoctoral training after you graduate from grad school.